Well, we're here with Dr. Riopelle, a medical doctor and a doctor who does lots of cosmetic surgeries, dermatology type of cosmetic surgery. Dr. Riopelle, a question. What is hyperbaric oxygen treatment? Can you explain that to us?
Yes. Hyperbaric oxygen treatment involves sitting in a chamber that's pressurized while breathing in a high level of oxygen. And what this does is this process takes oxygen to the body's cells at a much higher level. The oxygen then translates to faster healing, less inflammation, and better outcomes for treatment for various modalities.
I see. So what are some of those various modalities?
Well, there are quite a few things that the hyperbaric oxygen treatment is approved for, and then others that it's currently being used for that are still under investigation but have been used by physicians. So, for example, the hyperbaric oxygen FDA approval is currently in place for things like gas or air embolization, which is like a little bit of air that goes to the brain. It's approved for carbon monoxide poisoning, for any time that there's lack of oxygen to a particular body part, meaning acute traumatic ischemia. So like if there's a crush injury that's not getting enough oxygen to heal, it works very effectively for this purpose. It's also used for gas gangrene and for skin infections, particularly the what are called the necrotizing infections like MRSA, MRSA, where there's not enough oxygen getting to the tissue because the bacteria is taking over. Very, very serious type infections in this case.
Got it. That's what it is FDA approved for, right?
Right, yeah, and there are about 5 or 6 other things that are also great indications for it. For example, after chemotherapy and radiation, there's also often, for cancer, there's often tissue necrosis where parts of the skin or the body are dying because of the radiation as a side effect, and it can be used for that. It's used in burns, anytime one's trying to heal a wound, bone infections. A very common use of it is for diabetic foot ulcers because these are very difficult to get healed with more typical treatments. And then for skin grafts and flaps and for severe anemia. So these are all of the FDA-approved indications that it's used for.
I got it. So let me recap here. Hyperbaric oxygen treatment, basically, you sit or lay in a chamber. It gets high pressured, and because the oxygen it gets loaded with more pure oxygen than what you get in the normal air out there, right?
Right, exactly. Basically, the hyperbaric oxygen chamber is filled to a pressure of about 1.3 atmospheres, which is similar to going down maybe 8 to 12 feet in a swimming pool, that sort of pressure that you feel on your ears when you go down. At the same time, a high level of oxygen is pumped into the chamber, and what this does is the increased pressure allows the plasma in the blood and other liquids of the body to absorb more oxygen, and so as a result, it greatly increases the uptake by the cells, the tissue, the glands, the organs, the brains, and the fluids of the body. And this high level of oxygen is very, very healing in many cases, and you can't get it even with breathing 100% oxygen at a regular atmospheric pressure.
Because, and the reason for that is that when you pressurize oxygen, it liquefies, and that's why it mixes up with the blood, I guess, right?
Right, exactly. So suppose you're breathing in room air, which is about 20% oxygen. That room air has to go into your lungs, and it's absorbed into the blood, then it's taken to the tissue. It has to go from the blood into the tissue and then go into the cells. By the time you get to the cellular level, you have only about 1/10 to 1/20 the oxygen concentration that you actually breathed in. So the cells are seeing very little oxygen. When you increase the pressure and the liquefaction of the oxygen, you get much higher levels in the blood, which then translates to much higher levels going into the actual cells, and the actual tissue gets a lot more oxygen.
Well, and obviously that looks like something valuable, because after all, we know that oxygen is just simply probably the most important thing for things to live. If there's enough oxygen, it can live. So if there are some, as you said, FDA approved, if you have a drastic injury and oxygen doesn't go to a certain part, then it's FDA approved. But there probably are other reasons without having a drastic injury where simply oxygen doesn't go anymore where it's supposed to go. For instance, is it true, Dr. Riopelle, that I heard that the oxygen level is literally year by year or decade by decade falling? Basically, our air simply doesn't have as much oxygen anymore in it. Never mind that we're probably living a much more sedative life on a daily basis, and by doing so don't inhale full, capacity lung oxygen either anymore, and all of it could possibly lead that certain body parts are deprived of oxygen, especially small ones, like when it goes to the brain and areas like that where the vessels of blood which carries the oxygen become very, 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 very small.
Exactly, yeah, and that's a great case of an indication that's being used that's not currently FDA approved, but has been in studies shown to be effective, and that's in post-stroke patients. So someone has a stroke and now they're trying to recover. Maybe they're paralyzed, or have half their body's paralyzed, and the high level of oxygen going to the brain has been shown to be healing for those patients of the brain, and can make a big difference in terms of recovery. Same thing for something like cerebral palsy, where the brain is not functioning properly, and delivering multiple treatments of this high level of oxygen can actually markedly improve the cerebral palsy patient in terms of function.
Okay.
Autism is probably the most common use currently in the United States for hyperbaric oxygen. And again, although it's not FDA approved for that, because the treatment is available and we as physicians are allowed to use treatments for those things that we feel it is medically helpful for in our experience, there are many physicians throughout the United States who are treating autism patients with ongoing treatment of the autism using hyperbaric chambers. And even the younger patients, like the 1 and 2 and 3-year-olds, can get into the hyperbaric chamber and actually make it like a game, and they actually enjoy doing the hyperbarics. And there have been some very significant improvements to be shown in the course of their autism and the improvement. And many of the physicians who actually do this treatment are physicians who have children that have autism, and they got into the treatment initially because they heard this might work. They tried it on their own children. Their own children did well, and they wanted to advance this to treatment of other patients in their community.
Right. Well, as it should be. Absolutely. In fact, my wife and me have done hyperbaric treatment ourselves, and we have seen people who have problems with their legs, the diabetic people, with quite some drastic cures. And again, I don't think it's FDA approved for that, but I have seen people taking it and raving about it and getting their wounds on their feet minimized to a great degree.
Yeah, that's right. Yeah, and it's used for sports injuries very commonly now too. The Vancouver Canucks hockey team, which happens to be had the best record, I believe, in hockey this year, uses it on its players regularly to both heal sports injuries and for just rejuvenation. And Terrell Owens and quite a few of the NFL players use it, again, because they're in high-pressure, high-impact sports, and it helps to heal them more quickly or to rejuvenate their bodies more quickly. I even used it on my own son. My son plays for the De La Salle football team, which is the team that had the 151-game high school record of consecutive victories, and my son actually had a fracture in his back. And we placed him in the hyperbaric chamber for a number of treatments, and dramatically he improved very, very quickly. He was actually back to playing the sport at 3 weeks from the injury, surprisingly.
Wow, absolutely wonderful. Well, I guess, you supply the body with what it needs, and oxygen is one of those things, and the body is then meant to do its own thing. And also lots of people taking it for better skincare. Apparently movie stars and stuff like that. I don't know which one now, but I have read that there are certain movie stars out there which we know are relatively advanced in age and yet look pretty good in terms of skin, and I'm sure they do other things too, maybe not, but apparently it also keeps your skin better and young looking, and again, probably not something the FDA as such, has their approval stamp on it, but doctors like you or other doctors using it. Is that correct?
Yes, that is correct. Migraine headaches is another off-label use for it.
Really?
ADD, or attention deficit disorder, it's been used for chronic fatigue syndrome, Lyme's disease treatment, fibromyalgia. These are all other uses. They're actually another great area is the treatment of bowel disease, Crohn's disease, and ulcerative colitis. Those basically are areas of inflammation in the bowel, and because the hyperbaric oxygen decreases inflammation, physicians have used it for treating those diseases, as well as what's called ischemic bowel disease, where ischemic bowel disease is where the arterial supply, the blood supply to the bowel, has been compromised, and putting patients in the hyperbaric oxygen chamber increases the oxygen. And as you would conceptually think, if there's not enough oxygen in the first place, now you've increased the oxygen, you can make patients recover that might otherwise have lost large portions of their bowel.
Wow. Quite a bunch of uses out there. Are there many oxygen chamber facilities throughout the country, or is it still something which is, not yet as common as taking vitamins?
It's not very common yet. I think we're just seeing the tip of the iceberg in terms of the use of it at this point. And, for example, in the East Bay, there are no other facilities besides ours that I know of anyway that have a hyperbaric oxygen chamber in the East Bay or the San Francisco area. We're using it currently with a patient who was a near-drowning patient, someone whose family doesn't have a lot of money to spend on things that are not covered by insurance. So we're doing just a free treatments for a trial of 20 sessions for this patient who had the near drowning and has some neurologic deficit from it. And he seems to be making some progress already just in the first couple weeks of treatment. Another area is macular degeneration. A lot of elderly patients have this, and there have been some studies showing some potential improvements there as well.
Great. Wow. Oxygen, the universal solvent, I guess. Absolutely wonderful. Now, Dr. Riopelle, tell me, hyperbaric chamber, you just mentioned lots of those great things, even though many of them the FDA hasn't approved, but neither are most vitamins and neither are most, even exercise. I think it's not
right.
Only because they don't approve it doesn't also mean they ban it, right? Those are two different things, right? People need to realize those things also. Something which doesn't necessarily have somebody's approval doesn't also necessarily have you are not allowed to do it either, right?
Right, that's true. In the case of oxygen, the FDA views oxygen as a medicine, though. So unlike a vitamin, it has to be administered under the guidance of a physician. So one cannot just go and buy a hyperbaric oxygen chamber for themselves. The treatments have to be done under the guidance or prescription of a physician because it is considered a medication when it's used as a high-level oxygen treatment.